Welcome to our training on the effective use of supervision and case consultation. This lesson is composed of viewing this video. There is also one article that is attached in the lesson media that is there for your review. Additionally, there is a copy of this PowerPoint slide in your lesson media if you wish to use it. When you are completed with the lesson, you are required to take the attached quiz with a passing score of at least 70% in order to successfully complete this lesson. Supervision can be defined as an intensive, hierarchical, interpersonally focused relationship involving a supervisor who oversees the development of a supervisee's professional knowledge, skill, confidence, objectivity, and interpersonal interactions on behalf of or with a specified client for the purpose of facilitating and improving competence and effective service delivery and promoting accountability in the field. This definition has several significant conceptual and pragmatic components. Clinical supervision as a model involves a hierarchical relationship between supervisors and supervisees, where the former has some degree of power over the latter. While supervision is conceptualized as a helping relationship, and while it is most effective when supervisors and supervisees share rapport, trust, openness, and honesty, the supervisors are still administratively responsible for evaluating their supervisees and for requiring change where appropriate. Thus, supervisors still evaluate supervisees' effectiveness in their professional roles, and they work with supervisees to maintain or improve this effectiveness. They also make recommendations or decisions involving their supervisees' annual reviews, promotion, and continuing employment. The definition of supervision identifies the specific domains that facilitate supervisee effectiveness. Those are professional knowledge, skill, confidence, objectivity, and interpersonal interactions. Without the positive presence of all of these domains or characteristics, supervisees will not be maximally effective in their professional roles. For example, a supervisee might have the technical knowledge, the objectivity, and the positive interpersonal interactions needed to successfully provide services, but lack the confidence in her abilities and the skill to channel her knowledge into effective services. The supervisor must analyze these two weak domains with the supervisee and help her to develop approaches and techniques that increase her skill and to recognize and experience the professional and personal success that translates into greater self-confidence. Thus, supervisors must systematically evaluate the complex facets of professional knowledge, skill, confidence, objectivity, and interpersonal interactions in a supervisee's unique work settings, and then tailor them to the supervisee's specific job requirements and to specific environmental and situational realities, and finally, guide the supervisee towards sound practices and effective service delivery approaches. This process often involves identifying supervisees' skill and performance deficits, but if this is done in the spirit of supervision, the experience can be constructive and positive. From the definition that we have, we can identify 5 specific goals of supervision. First, to develop a supervisory system, process, or style that encourages supervisees to seek and respond to the supervisory process. Second, to evaluate supervisees in the professional knowledge, skill, confidence, objectivity, and interpersonal interactions domains to determine the supervisee's current developmental levels and professional strengths and weaknesses. Third, to enhance supervisees' growth in identified areas so that their provision of services and job and self-satisfaction improves. And finally, fourth, to monitor the welfare of clients served by the supervisees. While these are the goals for the supervisor, this training focuses on how the supervisee can help make the supervision more effective and help the supervisor to meet these goals. In the long run, when the supervisor meets these goals, it is for the benefit and the development of the supervisee. And so, there is a self-serving purpose in learning how to make supervision more effective, because making supervision more effective makes us better as professionals. We are now going to look at consultation. It can be defined as a collaborative problem-solving process in which two or more persons engage in efforts to benefit one or more other persons, in this case clients, for whom they bear some level of responsibility within a context of reciprocal interactions. Consultation is a collaborative process involving two peer or collegial professionals in a non-hierarchical relationship. The consultant has no administrative or supervisory responsibility for the consultee's work, and the dynamic or variable of power should be absent in the consultant-consultee relationship. The consultant may have more knowledge or expertise than the consultee, yet the consultee is under no compulsion to accept the consultant's recommendations or guidance. Additionally, consultation also may occur when two professionals simply choose to work together on a difficult case that one is experiencing. The consultant here acts more as a confidant or sounding board and has no formal or informal influence over the consultee who has requested help. The definition of consultation implies a problem-solving process that typically involves four components: problem identification, problem analysis, intervention, and evaluation. During problem identification, the consultant delineates and operationally defines the client's problem, ensures that the problem is indeed the client's, and proceeds with problem analysis, where a comprehensive understanding of the problem becomes the consultative focus. At times, the problem is identified not as the client's, but as the consultee's. In these instances, and when the consultee agrees to continue the consultation process, the consultant's problem analysis focuses on the consultee's professional knowledge, skill, confidence, objectivity, and interpersonal interactions, and how the consultee might be causing the problem. Intervention occurs when the consultant recommends specific programs or techniques to alleviate the problem, regardless of whether it is the client's or the consultee's. Again, the consultee can reject any analysis or interpretation by the consultant concerning the problem, its existence, or its significance. Similarly, the consultee can dismiss any projected recommendations. Finally, if an intervention is tried, the evaluation component of the process assesses the consultee's satisfaction with the consultation process and its positive effect on the identified problem. The definition of consultation implies that both the consultant and the consultee somehow share some level of responsibility for the client, who is the focus of the problem-solving process. From an administrative perspective, the consultee, who initially approached the consultant with the problem, always maintains the primary responsibility over the client and the problem analysis and intervention procedures related to the client. The consultant, meanwhile, assumes an ethical responsibility to suggest appropriate problem-solving approaches or intervention techniques specific to the client problem, and to oversee the professional well-being of the consultee. Ultimately, consultants are evaluated on their effectiveness in guiding consultees toward better problem-solving and service delivery approaches, and their ability to resolve the specific difficulties that existed between consultees and their clients. From this perspective, 3 specific goals can be identified for the process of consultation. First, to help consultees to understand the current work difficulty and to improve their knowledge, skill, confidence, objectivity, or interpersonal relationship abilities to resolve specific issues or conditions. Second, to help consultees to be able to handle similar problems that may happen in the future. And finally, to focus on consultees' job performance, not their sense of emotional well-being. Again, these are goals for the consultant, but this training focuses on making efficient use of consultation. Later, we're going to discuss specific actions that facilitate the consultation process. And again, ultimately, this is to our own benefit. Now that we have defined the processes of supervision and case consultation, we will move to a discussion of actions that you as a supervisee can take to make these processes more effective. A few authors have emphasized the importance of preparing supervisees to receive supervision and have provided suggestions for such preparation. Without exception, these authors suggested that a basic component of learning how to be supervised involved being exposed to the fundamentals of providing supervision, which is why we provided the information regarding the processes of supervision. Preparing supervisees to receive supervision can help them know what to expect or what to promote in ideal or less than ideal situations. The purpose of this lesson is to empower supervisees by providing information and practical strategies for embracing the possibilities and avoiding the pitfalls of receiving supervision. That is, for getting the most out of their supervision experience. Self-assessment of one's interest in and motivation for receiving supervision is a logical first step in preparing for the supervision experience. Supervisees need to ask themselves the degree to which they consider supervision to be an opportunity for learning, an inconvenience, a restriction, or an imposition. Several authors have maintained that qualities conducive to the successful use of supervision cannot be separated from qualities necessary to become an effective professional. As they develop these qualities, professionals need to be aware that a supervisor's assessments of their skills and knowledge are impacted by the supervisee's behaviors in supervision. Rodenhauser reported a number of supervisee attributes commonly listed by supervisors as highly desirable for successful learning in supervision. Among these qualities were the following: psychological mindedness and openness, interest and desire, motivation and initiative, enthusiasm and eagerness, dependability, interpersonal curiosity, empathy, willingness to risk, intellectual openness, the habit of developing professional knowledge, minimal defensiveness, introspection, receptivity to feedback, and personal and clinical flexibility. Additionally, Vespia, Heckman, Stone, and Delworth cited the following as most important supervisee behaviors and qualities: demonstrates willingness to grow, takes responsibility for the consequences of his or her own behavior, actively participates in supervision session, demonstrates respect and appreciation for individual differences, and demonstrates an understanding of his or her own personal dynamics as they relate to supervision. Supervisees might consider initiating a discussion of qualities desired by their supervisor with such questions as: what kind of individuals have been most successful and satisfied in supervision with you? What kind of students have been least successful and satisfied? What are some of the behaviors and qualities you value most in your work with supervisees? Questions such as these can provide valuable insight into the personal preferences of individual supervisors, as well as expectations and conditions unique to a particular clinical setting. Moreover, such questions allow the supervisee to demonstrate a number of the desirable qualities that were listed. Although beginning supervisees often have the misconception that supervisors just tell us what to do, supervisors are expected to function in a variety of roles depending on the needs of the supervisee. These roles include teacher, counselor, and consultant. In the teacher role, the supervisor functions as the expert who provides answers or instructs the supervisee in such areas as learning techniques, applying intervention, and conceptualizing. From the role of the counselor, the supervisor facilitates the self-growth and explores the personal reactions of the supervisee. The focus of supervision intervention from this role needs to be limited to helping the supervisee function more effectively as a professional. Finally, in the consultant role, the supervisor provides options and alternatives rather than answers, and the interaction is more collegial. Instead of instructing and directing the supervisee, the supervisor collaborates with the supervisee in such areas as case conceptualization and service planning. Supervisees can prepare for the corresponding roles of student, client, and counselor by reflecting on their desire to learn skills and knowledge, explore personal dynamics and reactions to clients, and discuss ideas and questions on a collegial level. These preferences are likely to be influenced by the student's level of professional development, with beginning supervisees preferring a supervisor-teacher who focus on specific skills and techniques. Additionally, supervisees can examine their personal preference for and comfort with each of these roles and consider goals for each. Although beginning supervisees usually prefer to function as students who want to be taught by supervisors, they may also have strong needs to assert their autonomy. Being aware of their own preferences and remaining flexible can prepare them for the various roles and preferences of their supervisors. The supervisee needs to understand what areas are important to supervisors and provide options when preparing to initiate or respond to specific topics in supervision sessions. Supervisors place the utmost value on supervisees implementing the supervisor's directives when client welfare is a concern. Thus, when choosing what to discuss in supervision, supervisees need to be mindful of and sensitive to the supervisor's concerns about vicarious liability or their legal responsibility for the actions of supervisees. Moreover, rather than being fearful of admitting mistakes or weaknesses, supervisees should realize that supervisors affect new professionals to struggle, and that admitting to and talking about these difficulties is welcomed by supervisors. Hiding mistakes and challenges makes supervisees seem defensive or arrogant, and increases the real threat to supervisees and their supervisors by almost guaranteeing that real versus imagined problems will occur. Awareness of these expectations can help supervisees prioritize when planning for supervision session. At the outset of each supervision meeting, any immediate needs of the counselor or the supervisor become a priority. It is important for supervisees to update their supervisor on any prior directives and suggestions, between session contacts for crises or emergencies, or ongoing difficult cases. Once immediate concerns have been considered, supervisees may want to mentally review their caseload. This reflective process can be facilitated by questions such as the following. What clients do I find myself often thinking about or seldom thinking about? When I think about a certain client, what thoughts, feelings, or reactions come to mind? Am I confused about what is driving a client's behavior or a client's internal dynamics? Am I uncertain about what to do to help a client change? Do I know what to do but am unsure of how to do it? Have I encountered a topic that is unfamiliar or uncomfortable? These and similar questions can help supervisees decide what cases to discuss and whether to focus on interventions, conceptualizations, personal reactions, or professionalism. Participation in each supervision session begins with taking an active role in establishing a tentative agenda for the meeting, offering to update the supervisor on the status of follow-ups to directives or suggestions, crisis or emergency cases, or other important pending matters is a useful first step. Additionally, requesting time for specific questions or challenging cases is also helpful. Providing this information accomplishes a number of things. It lets supervisors know that you are sensitive to their concerns and respectful of their expertise. It also helps supervisors make decisions about how to utilize time in the session and what topics to initiate. Finally, it helps ensure that supervisees are more likely to get their needs met. By being active in structuring the meeting, supervisees can help to reduce the frustration that results when one or both parties feel that essential matters were not addressed. Being prepared for the various roles that supervisors might slip into and out of when addressing those topics can also help to reduce potential confusion and frustration. When supervisors provide feedback about performance, teach or model interventions, explain the rationale behind interventions, or provide interpretations of client interactions, they're trying to instruct the supervisee from the teaching role. Operating from the counseling role, supervisors are trying to facilitate supervisees' self-growth as it relates to their professional development. Questioning supervisees about their feelings, whether in response to supervision, services provided to clients, or trying specific interventions, and providing opportunities to explore affective responses defensive reactions, worries, and personal strengths are all appropriate supervision interventions from the counseling role. From the consulting role, supervisors focus on the client in order to generate information and ideas about services. Accordingly, supervisors encourage supervisees to discuss client problems or motivations and brainstorm alternative conceptualizations or interventions. Rather than directing the interaction and providing answers, as is done in the teaching role, supervisors in the consulting role encourage supervisee choice and responsibility by providing options and alternatives instead of answers. Understanding the purpose of each of these supervisory roles can prepare the supervisee for responding in a complementary fashion from the respective roles of student, client, and counselor. Although supervisors are ethically responsible for the quality of supervision they provide, the ultimate beneficiaries are the supervisees and their clients. Knowing what to expect and what to promote in supervision empowers supervisees to make the most of an ideal situation and perhaps the best of one that is less than ideal. Rather than being passive recipients of supervision, supervisees can be proactive participants who impact the quality of their supervision experience. Recommendations can be summarized as follows. First, be proactive. Second, remain flexible. Third, ask for what you need, but do not demand it. Fourth, take responsibility for learning and growing. You are the ultimate winner or loser. Fifth, self-assessment and reflection are your best tools for improving as a professional, learning as a supervisee, and problem solving in relationships with clients and supervisors. Sixth, avoid blaming and focus on planning and problem solving. And finally, instead of focusing on what your supervisor does not provide, ask what you can learn from your supervisor. We need to remember that the primary purpose of supervision and learning is to enhance the quality of the service that clients receive. There are a number of supervisee abilities that actually maximize the benefit of supervision. First is an ability to work collaboratively with the supervisor. An ability to work with the supervisor in order to generate an explicit agreement about what will be accomplished in supervision. Working to make sure that the supervisor is aware of your current state of competence and your training needs. The ability to present an honest and open account of your work. An ability to discuss your work with your supervisor as an active and engaged participant without becoming passive or avoidant or defensive or aggression. And finally, in working with your supervisor, an ability to present material to the supervisor in a focused manner, selecting the most important and relevant material. An additional skill is the ability for self-appraisal and reflection. An ability to reflect on the supervisor's feedback and to apply these reflections to our future work. Additionally, we need the ability to be open and realistic about our capabilities and to share this self-appraisal with our supervisors. And finally, we need the ability to use the feedback from the supervisor in order to further develop the capacity for accurate self-appraisal. Another ability is the ability for active learning. This ability suggests that we look for relevant material that is referred to us by the supervisor and to incorporate the material into our practice. But also, we need to take the initiative in relation to learning by identifying relevant material independent of our supervisor's suggestions and to incorporate this material into our clinical practice. And the final ability is the ability to use supervision to reflect on developing personal and professional roles. We need to have an ability to use supervision to discuss the personal impact of our work, especially where this reflection is relevant to maintaining the effectiveness of our work. And we also need the ability to use supervision to reflect on the impact our work has in relation to our professional development. We're now going to move on to talking about case consultation, which we defined earlier. Please remember that case consultation is consultation regarding client issues with peers. There is no supervision, although a supervisor may discuss a case with a supervisee. That is always supervision. Whereas a group of people or two individuals getting together as peers to discuss a case is case consultation. There is no downside that I can think of to bringing a case to a colleague or clinical consulting group for feedback. But too often clinicians do not get the help they need. Either they don't know of a safe place to turn, or something like fear holds them back. Roadblocks and misconceptions about clinical consultations include thoughts like, my peers are going to judge me as inadequate, I will feel embarrassed or ashamed, I will be seen as less capable than my peers rather than their equal. It's normal to feel I don't need this. We may have a protective impulse to guard ourselves against the appearance of doing things wrong. The downside is that this fear cuts us off from what we all need in order to do the best for our clients and our profession, which is each other's experience and support. Consultation is always an opportunity for further growth. It involves a collaborative discussion rather than the straight-up offering and receiving of advice. We all need a confidant for support in a range of forms for many reasons. We can benefit from one another's experience. We're able to talk through challenging or difficult interactions that we may have with our clients. We're able to work through our own personal issues that may be triggered from our work with our clients. And finally, we're able to learn and use new techniques that may be helpful for ourselves or for our clients. Just having someone remind us of our strengths when we have a challenging caseload, or to validate what we are doing or thinking is on target, can give us the professional encouragement that we need to improve our skills. This is support we wouldn't have if we didn't make consultation a part of our self-care system. Probably the most common opportunity for case consultation at most organizations is the activity called group supervision. Too often, however, group supervision focuses on the administrative tasks and responsibilities for the persons working in the program. Sometimes it's just making programmatic and organizational announcements. Occasionally, it is a time for training for the staff members. Rarely is it a time for case consultation. In order for case consultation to work in group supervision, the formal supervisor must be able to communicate that he or she is stepping aside from the supervisor role and must encourage the group members to take the lead in the process. The boundary between case consultation and the other processes in group supervision must be absolutely clear and rigid. If you are not doing case consultation in your group supervision at your organization, maybe this is something you can discuss with your supervisor. Probably the most frequent of the formal case consultation processes occurs when the worker develops a trusting professional relationship with a peer, and the two agree to sit down on a regular basis to discuss their work. This type of relationship can be far-ranging, from personal support in our work, to personal development activities, to client-specific discussions. The benefits arise because the other person can be more objective than we are able to be because they are not involved in the case. And I'm stepping up the range of frequency. Probably the most frequent type of case consultation is informal case consultation. Did you ever find yourself walking through the office after a difficult client situation and you sit down at in a coworker's office and say, "Can we talk?" While this is a very informal arrangement, it can also be extremely beneficial. It builds trust within the team. It is not nearly as intimidating as having to do a formal case presentation. It benefits both us as professionals and the people that we work with. I wanted to start by describing these three types of case consultation so that we recognize that we have more opportunity for consultation than we may believe. Many of us may think of case consultation as only occurring in these last two opportunities that I have listed, which is formal groups either within our organization or outside in the community. While these are wonderful opportunities, sadly, they are too rare. Our agencies may be focused on billable hours, and when we're done with work, we just couldn't think about going somewhere to talk about work. If these opportunities are available to you, that's great, but I want to make sure that we recognize that we have far more opportunities to use consultation than just these situations. This completes our training on the effective use of supervision and case consultation. I appreciate your working through this with me. I was able to find one article that you might find very interesting. It is attached in the lesson media. When you are comfortable with the information presented during this presentation and also in the article, you are required to complete the attached quiz with a passing score of at least 70% in order to successfully complete this lesson. There is a copy of the PowerPoint slide that is available in the lesson media as well.